Making real change in public health takes both boldness and wisdom. Even the best ideas need a solid game plan to succeed. Greetings, everyone, and thank you for joining me on this episode. Welcome to Public Health Entrepreneurs, the podcast for visionary leaders who are ready to transform public health and healthcare through innovation. I'm Dr. Charlotte Huntley, and as a public health entrepreneur with over 25 years of experience in healthcare and public health, I understand the unique challenges and opportunities that come with bridging multiple disciplines. If you're an interdisciplinary professional, high-functioning leader with expertise across different fields, then you know what it's like to see opportunities that others miss. You also understand the gaps in our current systems, and you have a lot of really good ideas about how to make things better. Sometimes having a unique perspective can feel a bit isolating, and you may even feel a bit divided across your different disciplines or fields of expertise. I understand. And it's okay. I want to encourage you on these episodes, especially this one today. Today, we are going to specifically talk about the requirement of vision and careful planning as a strategy. I'm very strategic, so I get excited every time I talk about anything to do with strategy. As change makers, we often find ourselves caught between our passion for transformation and the practical realities of system-wide change. Whether you're leading a community health initiative or reimagining public health delivery, this episode will help you bridge the gap between visionary thinking and effective execution. Well, let's start by focusing on our intention for the week. If you've been following on these last several weeks, you've noticed that I guide you through setting an intention for the week. And after that, I share some actionable steps for you. So I'm going to share with you an intention that I created for this week. You can try it on for size. Feel free to embrace it, tweak it for your own use. But along with our topic and title, I have this intention. This week, I balance my drive for innovation with strategic thinking. I understand that meaningful change requires both vision and careful planning. How does that feel? I kind of like that. As always, I have some reflection questions for you, and I do recommend that you take a few moments with each of these questions, write down and process the response that comes to mind for you. I have 5 questions. I typically have 5 questions, so the first question, what innovations am I most excited to bring to public health? The second question, where have I faced resistance to change and why? The third question, how can I make my innovative ideas more accessible to stakeholders? Kind of like that one because that's actually anyway, I'm just going to put them out there. It's very difficult to put these reflection questions out there without trying to coach you through it. And I'm just imagining you sitting there, but please sit with these questions, each one of them for a couple of minutes as you process and think about, and then just write down or type out what comes to mind. All right. So number 4, what resources do I need to implement change effectively? And then finally, how can I better balance quick wins with long-term transformation? I would love to know what your responses are for these questions. This is an exciting part of coaching and guiding my clients through these processes and on this journey. But I just encourage you to go through that. You can take your responses and you'll process. And then I'm going to share a few action items, and maybe you'll be able to implement some of these into place based on what your responses are and kind of where you are as well. So here's some action steps. You can create or perform an innovation audit. That means listing current system pain points. You're aware of them. You know what they are. Document potential solutions. You have a solution, likely a great solution, those great ideas that you have. Rate implementation feasibility. How feasible is your plan to be able to implement your solution? And identify key stakeholders. It's very important. Another action item that you can take, another action step you could take would be to perform a strategic planning. Create 30, 60, 90-day goals. Map out the required resources and identify potential barriers and plan mitigation strategies. That's really important. And then another, number 3, in terms of action steps that you can take is stakeholder engagement. List the key decision makers and create a communication plan. Develop a pilot proposal, like how could you pilot the idea or plan that you have, and then schedule presentations. It's important to get this in front of people. Another action step for you could be to perform an impact assessment. Define success matrix that only you can define what would measure the success. Set measurement timelines and create feedback loops. We talked about this, some of these previously on previous episodes as well. Very relevant here. Plan adjustment points. It really comes down to this. Making real change in public health takes both boldness and wisdom. You've got these brilliant ideas that could completely transform how we deliver public health and touch so many lives. And that's incredible. But here's the thing, even the best ideas need a solid game plan to succeed. So take a step back, look at what you're doing now, talk to the people who matter, and figure out how you'll know when you're winning and whether you're dealing with what's right in front of you or dreaming big for the future. Don't lose sight of either piece of the puzzle, your bold vision and your smart strategy. They're both essential to making all of it work. Setting an intention along with these action steps will help you create a framework for how you experience your week. They help you stay aligned with your values and maintain focus on what matters most. If you are ready to work with someone more closely to fully explore what's possible for your vision, then I invite you to consider working with me. As a public health entrepreneur who works with highly functioning leaders like you, I provide the trusted soundboard and guidance that you might be looking for. Feel free to reach out to me through our website to explore options for working together more closely. You won't see one-on-one coaching as an option on our website because we don't normally offer that. We don't normally have the space for that, but right now I do. So just simply go to our website, which is publichealthentrepreneurs.com, and click on contact us and send a message. Say, I heard about this opportunity on the podcast and I'd like to explore that with Dr. Huntley. And we'll get back to you. All right, everyone. Until next time, have a fantastic rest of your day.